Hello everyone. Today we're going to be talking about a topic which is a very important topic for all of us working in healthcare research domain. And that's called clinical outcome assessment, in short COA. So this is going to be a short presentation, not a very long one, and we're going to be skimming through the main concept of clinical outcome assessment, what it is, and a few other details. So without much ado, let's move on to the next slide. So in this short presentation, I just said earlier, we're going to be talking about these main talking points that are: what is a clinical outcome assessment, what are its different types, and how do we develop and validate a clinical outcome assessment, and what is the importance of a clinical outcome assessment. Finally, we will summarize the overall presentation. In the end, providing you the resources that are used for developing this presentation, we will close this presentation. So with the first thing for us to understand is, what is a clinical outcome assessment? So as you would already be getting an idea from the name of it, clinical outcome assessment is a measure. It's just sort of a measure, which what it does is that it helps us to describe or reflect that how a patient is actually feeling, functioning, or surviving. So think it in this way, that when a patient receives a drug, we would obviously like to know that after receiving the drug, how is the patient feeling? Has there been any change in the function? Or what is the impact of treatment on the survival, or you can say the mortality? So in all, clinical outcome assessment is a tool that helps us to measure the patient's feeling, function, or its survival. So when we talk about these different aspects, such as feeling, function, and survivals, how we will know about it? So if we just think a little bit more about it, we will come to know that all these different aspects about patient can actually be told from different perspectives. And when we say about these different perspectives, these are like this. One is the patient perspective. So we can actually know about a clinical outcome assessment, or we can do the clinical outcome assessment of a patient by knowing how a patient is feeling or functioning by asking simply to the patient. That will be the patient's perspective. Second can be, we can actually ask clinician or the doctor treating the patient, the trained medical practitioner. We can ask that person about the outcome, the health outcome of the patient. So because that is coming from the clinician, not from the patient, that will be called clinician's perspective. And third can be the observer, a third person, not the patient, not the clinician, a third person. This person can actually be a nurse or other healthcare providers or other healthcare personals, to be correct. They can also be caretakers. They can be caretakers of patients. For children, you can have parents. For elderly patients, you can have other caretakers or family members. They can provide the response on behalf of patient. So all in all, we understood that a clinical outcome assessment actually provides insight into the effectiveness of any treatment from three different perspectives, such as patients, clinicians, and observers. It can include measures of symptoms, physical function, quality of life, and patient satisfaction. These are just some of the examples. There can be others as well. So now let's move on to the next slide. What are the different types of clinical outcome? As we have just discussed in the last slide, that a clinical outcome assessment can actually be done from three different perspectives. So we'll go by that. The first one is the patient reported outcome. as you would obviously now understood, that this comes from patient's perspective. We can say that PRO, which is the short form for patient reported outcome, is a measurement based on a report that comes directly from the mouth of the patient. Means, as you say, the directly from the horse's mouth. So it's actually, what do you do in while assessing health outcome using a PRO tool or a patient reported outcome tool, is that you simply ask the patient. You have a questionnaire, you will ask different questions to the patient which are related to the health outcome, and the patient will respond. There will not be any interpretation from clinician or anyone else. It will be directly what patient feels, he tells, based on a pre-specified questionnaire. So that's called as PRO, which is a type of a clinical outcome assessment tool. Second comes clinician reported outcome. We also call it ClinRO. As now, by now you would obviously know that this is the type of COA which provides the clinician's perspective. So it is actually a measurement which is based on a report that comes from a trained healthcare professional after observation of patient's health condition. So it usually comes from the doctor who is treating the patient. Okay, it can actually come from other healthcare professionals as well who are treating a particular patient. So that's the second type of COA or clinical outcome assessment. That's called ClinRO. Now let's move on to the third one. That's called observer reported outcome, or OBSRO in short. So as you remember, in the last slide we talked about third person, not the clinician, not the patient. So this is that third person. So in ClinRO, what we can say is that it is a measurement based on a report of observable signs, events, or behaviors related to a patient's health condition by someone else other than the patient or the healthcare practitioners. So one of the very easy thing to understand observer reported outcome is that for certain conditions we can't get accurate description of the health status by asking to the patient, because the patient happens to be a 5-year-old child. In that case, we will ask the parent of the child, means the person who is taking care of the patient. Similarly, in the case of an elderly patient who may not be in a position to tell his experience or his feeling, we will ask the questions to the caretaker of the patients. So now, as we discussed in the last slide, now we understand the three different type of clinical outcome assessment. One is the patient reported by patient. Second is clinician, reported by clinician. And third is not the patient, not the clinician, actually the observer, a third person. Now let's come to the fourth one. This is something which we didn't discuss in the last slide purposefully. It makes the understanding easier. Now this fourth one comes into the picture when you think about the clinical outcome in this way, that neither you want to ask to the patient, nor to the clinician, nor to the observer. You want the patient to perform certain tasks, and then based on patient performing those tasks, there would be a score or outcome, and that is what you assess. So by the explanation of it, by now it would be clear to you that this fourth clinical outcome assessment type is called performance outcome or PREFRO. So it is actually a measurement based on standardized tasks that are actively undertaken by a patient according to a set of instructions. So like the example which is provided in the slide is called 6-minute walk test. So in this case, a patient is asked to walk for 6 minutes, and there are certain parameters that are measured during this walk, and that will serve as the outcome. So these are the 4 different types of clinical outcome assessment. Now let's talk about how we develop and validate these clinical outcome assessment. So to give you an overview of this, developing and validating a clinical outcome assessment involves several steps. So there are different steps that are involved into developing a COA from the scratch. Okay. there are three major things that you need to remember when you want to think about developing or validating a clinical outcome assessment. And these three major steps or points are: first, concept elicitation; second, cognitive interviews; third, psychometric evaluation or validation. Let's go into each of these quickly, one by one. So, concept elicitation. What exactly it is? It is simply a process in which it involves identifying the relevant concepts that patient considered important. For a particular disease, if you want to develop a clinical outcome assessment tool, you will first identify those concepts that are important for patient to get the information with respect to that particular disease. Okay, so you want to talk about, or you want to ask those concepts to the patient with respect to a particular disease that are of importance to patient when we are talking about a particular disease. So if you want to assess the clinical outcome in a disease wherein the movement of patient is hampered due to pain in knee, the usual concept in a COA tool will have elements of that. Okay, they are not going to be having elements about whether you are feeling depressed or not. They're going to be more about how much stiffness you are feeling in your knees. Are you feeling any pain in your knees? This is just an example which I'm giving you, but just try to make a picture in your mind that the most important thing for developing a COA is to first, concept elicitation, wherein you identify the relevant concept for that particular patient population, keeping the disease for which you want to focus in mind. Second is cognitive interview. What does it does is that it assesses the patient's understanding of the questions and responses and the response options that you have for the patient. So once you identified what are the concepts that you're going to be asking to the patient to understand the outcome for a particular disease, second thing is that you would do a cognitive interviews to assess whether actually the patient is understanding what you want to know or not. Okay, whether the patient understands the question that you're asking him or whether the patients understand the response options as well. Patient should know that, suppose if on a meter of 1 to 10, if he marks 9, it says that the situation or the symptom is severe. Okay, it should not be the other way around. So the patient should have the idea, or he should have a clear picture of, or the understanding of the question and the response option to the question. Now let's move on to the last one in this slide. That's psychometric validation. What does it do? It assesses the reliability, validity, and responsiveness of a clinical outcome assessment tool. So once you have done the concept elicitation, you've done the cognitive interview. Now, in the end, you will do psychometric validation. What it does, it essentially assesses whether the tool that you have developed is reliable or not, whether it is valid for that particular disease or not, whether it is responsive or not. So these three different words have different connotations to this when it comes to clinical outcome assessment tool, and we can talk about this later in the other presentation when we want to sort of discuss more deeper in this topic. So as of now, we can keep these three main points in our mind, that when we are developing or validating a clinical outcome assessment, we start with concept elicitation, we also do cognitive interviews, and we perform psychometric validation. Now let's move on to the next slide, which is the importance of COA in clinical trials. So why do we develop clinical outcome? What is the use of it? So one of the most important use is that we want to use these clinical outcome assessment tools in clinical trials when we want to know whether a particular drug is working or not, whether a particular drug is actually giving an outcome for which it is developed. How do we assess that? We assess that using specific clinical outcome assessment tool. So one of the very first application or importance of a COA is that it is used in clinical trial because it provides insights into what patient experience when you give a treatment to the patient. It also helps us, another the most important part or the most important use of clinical outcome assessment is that it helps us in regulatory approval. Okay, so because regulatory approval or regulatory bodies across the world would like to know in a quantifiable way that when you give a drug to a patient, whether the outcomes are improved or not. And if you're saying that outcomes are improved, what are the metrics that you have used? Whether that matrix is standardized or not. So for that purpose, a clinical outcome assessment tool becomes very important. So first is regulatory approval. Second is labeling claim. So what is labeling claim? Labeling claim is kind of a claim that a particular drug maker makes for a particular health technology that or a medicine that the drug maker had developed, that this particular drugs can be taken as a treatment for these conditions, or if it will improve these symptoms. So all those claims that a particular drug maker makes for a particular drug is based on the assessment done using clinical outcome assessment tools. And the third is market access decision. So when we talk about approval being granted, labeling claim have been laid in the label for a drug, the third most important part comes is the market access. So the payers who decide that whether this particular drug or health technology is value for money to be given to the patient for which the payer is providing coverage. How does a payer decides that? So a payer decides that on the basis of clinical outcome assessment, whether the mortality is reduced, whether the depression is reduced, whether the psoriasis symptom is reduced, okay, whether the headache is reduced. So there are different things that can actually be measured through clinical outcome assessment, and it kind of standardized the process of measurement of all these different symptoms or outcomes, healthcare outcomes, as we may say so. So additionally, in the end, we also know that clinical outcome assessment can help in developing a patient-centered care, because at the center of it, we are keeping the patient. Okay, so whatever comes out of it, whatever decisions we make in terms of granting approval for a drug, in terms of whether we should give access to a particular drug or technology, to what particular population the access should be granted, all those things would actually be driven through a clinical outcome assessment tool that would already have kept patient at its center. So in a way, clinical outcome assessment actually helps us to develop patient-centered care. So that's the kind of importance a clinical outcome assessment have. Now, in the end, now as we have talked about most of the important points about the clinical outcome assessment, now let's just quickly summarize what we learned. So it can actually be summarized in 3 quick points. First is that now we know that clinical outcome assessment is a very vital component of any clinical trial. Why? Because it provides insight into the patient's experience with the treatment, and that's what we want to measure in any clinical trial. We want to know whether the patient's experience or the healthcare outcome, we can also call that healthcare outcome, has improved or not. How do we know that? We know that with the help of a clinical outcome assessment. Second, a clinical outcome assessment or a COA tool helps us in regulatory approval, labeling claims, and market access decision, along with obviously enabling a patient-centered care. So this is one of the very important outcome of a clinical outcome assessment. Okay, and third one, which we have learned in this presentation, is that when developing and validating clinical outcome assessment, it actually involves several steps, and what the important steps are: first, we start with concept elicitation, and then we move on to cognitive interviews, and the last one is the psychometric validation of the tool. So this is just a brief presentation about clinical outcome assessment. These are some of the resources that have been used to develop this particular presentation. Obviously, there are several other freely available papers and other resources available on internet that can be used to develop more detailed understanding of clinical outcome assessment. The purpose of this particular slide was to just give you a kind of a bird's eye overview of what a COA is. And with this, I would like to thank you for your time which you have given for listening me for this particular presentation. If you have any questions, please write to me or put a comment to this video, and I will be more than happy to respond to the extent possible. Thank you. Have a good day.